The subject I was covering was the challenges of cancer research. Essentially, this boils down to the question of complexity, both in cancer itself and in how we can apply it to develop new approaches to treatment in the clinic. So I talked rather generally about our evolving understanding, particularly of cancer genomics and of how the immune system responds to tumours, and then went into some more detail about how we need to work this into our clinical treatment algorithms, how we're doing molecular diagnostic testing, and how we're analysing the results of immunotherapy. We work in a healthcare system which is constrained for resources, and in order to apply molecular diagnostics, for example, you have to screen an enormous number of people with molecular testing in order to make new treatment available to a relatively small proportion of them. One of the things we've learned from all the molecularly targeted trials of treatment, such as the Cancer Research UK Stratified Medicine Programme and National Lung Matrix trial, is that only around 5% of patients will end up getting a novel treatment out of all those that we screen. So we have to develop a system where broad molecular diagnostics is fundable and is applicable in order to make sure that we bring the new treatments to a relatively small proportion of people still. One of the things we're seeing is an explosion of cancer immunotherapy. At the moment it's checkpoint inhibitor antibodies, soon it's going to be combination therapies, soon it's going to be cellular therapies. And all of these create challenges and demands for oncology pharmacy, which I think it's very important for them to know about in advance so that they can gear up and respond. Pharmacists are the absolutely key link between the ideas of treatment and the practical application of them. Whether it's the conduct of clinical trials or whether it's in routine service provision, all of these things hinge absolutely on the expertise of the pharmacists.